Hello dear friends, welcome to my YouTube channel. So today we will continue with the biopharmaceutics and pharmacokinetics related question discussion. Question number 51. A specific drug has a first order biological half-life of 4 hours. This half-life value will. The options are be independent of the initial drug concentration, increase when the concentration of the drug increases, decrease when the concentration of the drug increases, decrease if the patient has renal impairment, be the same whether the drug level is determined in the blood or by observing the pharmacological action. So here the correct answer is option A. That is, in first order kinetics, the half-life value will be independent of the initial drug concentration. Most drugs have biological half-lives that follow first order kinetics. A basic characteristic of first order kinetics is that rate constants for metabolism or excretion are independent of the initial drug concentration. Next one, pH is, the options are not temperature dependent, a measure of acidity, the same as pOH, high for acids, none of the above. Here the correct answer is option B, that is pH is a measure of acidity. pH is the negative log of the hydrogen ion concentration or hydronium ion concentration. Next one, the biological half-life of many drugs is often prolonged in newborn infants because of. The options are a higher degree of protein binding, microsomal enzyme induction, more complete absorption of drugs, incompletely developed enzyme systems, incompletely developed barriers to the distribution of drugs in the body. Here, the correct answer is option D, that is, the biological half-life of many drugs is often prolonged in newborn infants because of incompletely developed enzyme systems. The metabolic pathways of newborn infants are incompletely developed at birth, most notably the oxidative and conjugative mechanisms that are known to metabolize many drugs. Question number 54. Characteristics of non-linear pharmacokinetics include. The options are follow zero-order kinetics. Elimination half-life will change as the dose is increased. Half-life is expressed in terms of fraction per unit time. Here the correct answer is option C, that means 1 and 2 only. That is, the characteristics of non-linear pharmacokinetics include it follows zero-order kinetics and elimination half-life will change as the dose is increased. Linear pharmacokinetics follows first-order kinetics in which the half-life does not change as the drug dose is changed. In the question they have asked us about the non-linear pharmacokinetics which follows zero-order kinetics. Okay, so in zero-order kinetics, the rate is a constant and clearance is inversely proportional to plasma concentration, and always a constant amount of drug is eliminated in unit time. Then this nonlinear pharmacokinetics usually reflects the effect of enzymes or the presence of carrier-mediated systems. In these situations, the elimination half-life of the drug will increase when the dose is increased. Next one, a knowledge of the clearance of a given drug is useful because it allows the options are calculation of the maintenance dose required to sustain a desired average steady-state plasma concentration, determination of the volume of distribution, determining of the ideal dosing interval, decision whether a loading dose is necessary, determination if the drug is metabolized or excreted unchanged. Here the correct answer is option A. That is, when the clearance of a drug is known, the maintenance dose required to sustain a desired average steady-state plasma concentration can be calculated. Okay, so the volume of distribution is useful to calculate the loading dose, whereas this clearance allows us to calculate the maintenance dose of a drug. Which of the following values is likely to increase in the geriatric population? The options are blood level of albumin, enzymatic metabolism, total body water, volume of distribution of lipophilic drugs, volume of distribution of water-soluble drugs. Here the correct answer is option D, that is, in geriatric population, volume of distribution of lipophilic drugs will increase. While all of the other values tend to decrease in the elderly, the volume of distribution of lipophilic drugs may increase since the proportion of body fat increases. If a fixed dose of a drug that is eliminated by first-order kinetics is administered intravenously at regular intervals, the time required to achieve a steady-state plasma levels depend only on the options are dose of the drug, volume of distribution of the drug, elimination half-life of the drug, dosing interval, fraction of the dose absorbed or bioavailability. Okay, note down here in the question they have asked about first order kinetics. Okay, so here the answer will be option C, that is the elimination half-life of a drug. Okay, that is if a fixed dose of a drug that is eliminated by first order kinetics. Okay, first order kinetics is administered intravenously at regular intervals. The time required to achieve Steady state plasma level depends only on the elimination half-life of the drug. Next question. A basic principle of drug absorption is that a drug is usually not absorbed unless the pK is high, unless the surface area is optimal, until it is metabolized, until it is in solution, until it has passed to the colon. So here the correct answer is option D, that is until it is in solution. That is a basic principle of drug absorption is that a drug is usually not absorbed until it is in the solution form. Which one of the following statements is incorrect? Sublingual drug administration is suitable for drugs that the options are have a high molecular weight, have high lipid solubility, undergo pre-systemic metabolism in the liver, are non-ionic. Okay, so in the question we need to find out the incorrect statement or the wrong statement regarding the sublingual drug administration. So here the correct answer is option A, that is have a high molecular weight. Remaining all other options, that is have high lipid solubility, undergo pre-systemic or first pass metabolism in the liver, then are non-ionic. All these statements are true regarding the sublingual drug administration. Question number 60. Salicylic acid has a pK of 3 and undergoes significant renal tubular reabsorption. In aspirin overdose, the renal clearance of salicylic acid will be increased to the greatest extent by. The options are acidification of the urine, alkalinization of the urine, acidification of the urine plus forced diuresis, alkalinization of the urine plus forced diuresis. Here, the correct answer is option D, because we know that aspirin or salicylic acid is acidic in nature. Okay, so here the answer will be D. And remember the two golden rules here. The first rule is only the unionized drug will be absorbed and ionized drug will get excreted. And rule number 2 is absorption requires same medium, that is acidic drugs in acidic medium and basic drugs in basic medium. And for excretion, opposite medium is required. Okay, suppose here the aspirin or this aspirin is acidic in nature. So okay, so it will get excreted in the basic medium. So alkalinization of the urine plus forced diuresis is the best method in case of aspirin overdose. This alkalinization of the urine can be done by IV infusion of sodium bicarbonate. Okay, so this acidic drugs get excreted in the basic medium. So we have completed today's question discussion series. Thank you everyone. Thank you for watching this video.